Hey y'all. All right,
Hey,
hello.
how are you? I've been watching you dance a little bit for a couple minutes now.
Yes, I like to dance and I was trying to press accept. I was having a little issues, so thank you for your patience. How are you doing today?
I am good. Happy World AIDS Day.
Happy World AIDS Day. Thank you so much for taking some time out of your day for this conscious conversation.
Of course, a pleasure.
Um, and welcome everyone who is tuning in now or who will be watching this video a little bit later. Excited to introduce our guest for this next edition of Conscious Conversation brought to y'all by Can't Stop, Won't Stop Consulting. Wanted to just also note we've been working with our accessibility coordinator, Melissa Kelly Colibri, and we were supposed to have an ASL interpreter today. But we won't be able to. But what we are committed to doing is sharing this video, and we are coordinating with an interpreter to do an interpretation of the video, and we'll repost the video with ASL interpretation. So just wanted to make that note from the top. And if it's okay, Jose, I'm going to read a little bit of your bio so folks can know a little bit more about you, and we can dive right in. Is that okay?
Yeah, go for it.
Okay, awesome. So Jose Ramos was born and raised in Michoacan, Mexico, and migrated undocumented to the United States at 9 years old. Jose was raised in a family of field workers in California and was the first child of 8 to finish high school and later obtain a master's degree. He worked as an executive leader for Target Corporation for 12 years. And in 2009, Jose founded Impulse Group, a volunteer-based gay group that focuses on engaging, connecting, and supporting gay men globally. And it was formed in West Hollywood. Impulse Group comprises of chapters in 25 major cities, in 12 countries, and in 5 continents, including here in DC, which I'm proud supporter of here of the DC chapter. And Jose currently works as the National Director of Pharmacy Sales for the AIDS Healthcare Foundation.
No wonder I'm tired, huh?
I was like, okay, I have enough breath to get through the
I know,
bio.
I know.
And I'm sure this is not even everything that you do. So this is a small bio, but looking forward to digging into this conversation.
Same.
So first, Jose, we ask a couple of questions to all of our guests. And the first of 2 that we ask all of our guests on Conscious Conversation is, in the spirit of Ella Baker, who are your people?
Who are my people? Like my advocates, the people that I admire?
I would say it's people you admire, people that you are in community with, people who you feel like that you come from or represent.
So, I was born and raised in Mexico, so I do have a strong connection to some of the Mexican figures like Frida Kahlo. I love that kind of art, Emiliano Zapata, right? Revolutionary back in the days. And here where I am now, like Impulse Group is my people. That's my tribe all around the United States. I mean, my best friends are part of Impulse. So that is the people that I gravitate to, the people that care about something beyond themselves will be my people.
Yes, I love that. Yeah, when I think about this question for myself, I think about like dancers, healers, organizers, like warriors for justice. So I think there's some alignment and some connection there in terms of our people. Um, the next question we like to ask all of our guests is, when was the last time you felt brave?
Ooh, so recently, 2 months ago, Impulse Group, we are sponsoring, funding a documentary series around gay men and our trauma
Mm.
on video. So one of the stories is my personal stories, and for me, it was really brave because I've never spoke openly about my trauma as a gay man and what it has done for me. So when I did the shooting a couple months ago, I think it was probably the hardest thing I've ever done.
Mm.
And I won't spoil it, but when it comes out, it will be the bravest thing I've done in my life.
Wow. Okay. When does that come out?
So it's gonna come out at the beginning of next year. We're finishing, so there's 5 stories around gay men and the trauma that we experience and how it plays out. So yeah, stay tuned. It's gonna be. I'm hoping that it will, shine some light into the trauma that we experience and how untreated, how it manifests.
Absolutely. Well, please keep us posted. Sounds like something that I would be interested in. A lot of the folks that we are in community with would be interested in. Who doesn't love people just sharing their story and being vulnerable? So, looking forward to that coming out.
Thank you. Stories are very powerful. I always tell people, if you just share your story, you'll be surprised how much impact you can make.
Absolutely, absolutely, and we all have a story to tell.
Yeah.
That's also something that I believe. I think sometimes, especially in this time of social media, sometimes people are like, "Well, I don't have the same platform," or "I don't, I maybe don't, I'm not a celebrity or make certain kind of money." It's like, no matter who you are, no matter what identities that you hold, you have a story to tell. That's my belief, and I think us sharing our stories inspires, encourages, motivates other people to share their stories as well.
I agree. What I love about stories is no one can take it away from you,
Mm,
right? So it's not about you agreeing with it or what is your story and is your reality and is your truth. So that's what I love. Nobody can take it away from you at all.
yeah, absolutely, absolutely. Um, speaking of stories, I would love to love to give you an opportunity or ask you a little bit more about some of the work that you do. Clearly, part of your role or part of what we shared in your bio was talking about how you started Impulse Group. Can you share a little bit about what inspired you to do that?
So it started about 13 years ago, and I always tell people my advocacy didn't start when I started getting involved with Impulse. I remember being, 14 years old in high school here in LA County in Ventura. I used to volunteer back then with mothers who have lost kids to AIDS, and we used to go with them around high schools and colleges. I started, I funded the first queer group in Ventura County. Like this is 30 years ago. Right now, it doesn't seem like a big deal, but in suburbia of California, it was a big deal. So I started early on. I never thought I was being an advocate back then. It was just
Mm-hmm.
always my passion. But when I came to California, to LA, I went to school and, I got into the corporate job and it was nice and I was making decent money. But after I got older, as I got older in my later 20s, I feel like I was missing something. So
Mm-hmm.
then 13 years ago, my best friend got diagnosed with AIDS here at Cedars-Sinai. I never seen AIDS in my life. This beautiful Latino man ended up in the hospital, and when nobody knew he was gay, so I was the only one really knowing what was happening, and I took a little time off of work to take care of him. I've never taken care of an AIDS patient. I've never seen the ulcers, the hair, the deterioration of their bodies. So for me, it was extremely dramatic to be able to
Mm-hmm.
see somebody. He did make it through. He's alive and a close friend of mine. But when I saw him go through that, and then I got out of, we got out of the hospital, and in the city that I live in, I live in LA, WeHo-ish. We are entitled people. You know, we have a lot of services. And 13 years ago, I didn't understand why in such a city with so much resources, many of us were becoming HIV positive. I was not positive when Impulse began, which a lot of people think I was. It was really because of my friend. I saw it. Then I wanted to get involved. And back then, you only had two options. You showed up for a benefit and played for a plate, donated money, or, you know, you would just once in a while participate on Thanksgiving, or you'll do gifts. It was very limited, or you have to like really go into the field of nonprofit work and make it your life. And there was nothing in the middle. I'm like, I want to work in my career and want to get back to the community in a way that is meaningful to me, in a way that I can mentor, you know, younger gay men, because I always wish I had a mentor growing up of what it's like to be gay, what it's like to be sexually, you know, free, but also sexually responsible and be healthy. So when I tried to volunteer, I actually became a tester. I was not the best of testers. I tried to do volunteer and to organize some kind of paperwork. I also did awful work. So when I decided, when I went back to AHF, AIDS Healthcare Foundation, they're the ones who diagnosed my friend. And they were the ones who helped him with medication when he got out of the hospital. So I was committed to give back to them. And when I asked Michael Weinstein, the CEO, how can I volunteer? You know, I did different things with AHF, but it was not until I stepped back and say, what are we missing? I want to talk to gay men the way that my friends talk to me. I want HIV to be a discussion around, you know, how do we do this together? You know, we live in the city. The government is not going to save us. The city is not going to come in and save us either. We have to do it for ourselves. And when I started talking to my friends, it was not a very popular idea, believe it or not. 13, 14 years ago, talking about HIV and AIDS was not, I wasn't the most popular kid in town, but I did get close friends of mine. I used to bribe them with wine and alcohol to come to my meetings. And it really began in my kitchen. It was just 6 of us, close friends of mine. And we decided to get involved in a way that we were meeting gay men where they were. And we were taking away the stigma and just celebrating our sexuality, but encouraging a healthier way of living. That's literally how it all began. We had no money. We used to do body shots to raise money. I mean, you know, I was also 29, so I could get $2 for a body shot. But yeah, we really started with nothing, but it was just a group of friends trying to get involved in a city that we really care for.
That's awesome. Thank you for sharing that. I'm curious, you know, that was, you said it was like 13 years ago, 12 years ago.
2009.
Clearly a lot has happened since then, and especially over the last couple of years. How has the pandemic affected the work that Impulse does, and how do you continue to support the chapters throughout the globe?
Well, you know, so our mission changed actually right before COVID happened. We used to be very heavily involved around HIV and AIDS prevention and treatment, and we still focus on that. But we changed our mission to be more broad. How do we engage and connect and support gay men globally? And then the pandemic happened. So how do we engage really was taken away from us because we're a social group. So a lot of what we did was in person. So when the pandemic happened, it really paralyzed us for a while. And then we had social justice, the reckoning that happened in our city, in our country, all of that together, it got us to the point where, I'll be honest, I'm like, I don't know how we're going to survive. But we did. And how we supported the teams, we started going into different ways, different platforms that we've never used before. You know, we started, as everybody, right? We were Zooming away every day. We were doing things like this on Instagram. We were doing videos. We really tried to stay involved to some capacity. But we did lose ourselves a bit. Right now, I just finished a meeting with a lot of the new leaders because a lot of people that were part of the group also we lost because a lot of people in the big cities, right, with the pandemic, they went back home or they returned back to where they came from. So not only everything was going on, we lost like half of our membership in the United States. And it was really took a lot of work to rework and recruit people, but also how do we stay engaged? And we really use a lot of the platforms, social platforms, to keep active and stay engaged with our communities, but also with the teens.
Yeah, I feel like that adaptation is something that so many of us had to do or tried to do more of, especially through the pandemic. And even as there is, as I like to say, we're re-emerging, right? We're starting to do some in-person things. I think people are starting to think about what is the safety protocols like with masks and asking folks to be vaccinated. I know more folks are getting their booster shot now. And so I think it's going to be an interesting and ongoing conversation about what does it take for people to feel safe, but for us to continue to build and have this sense of community and camaraderie. So I think it's a helpful kind of discussion around how that has shifted and will continue to shift likely for Impulse and for other communities and organizations.
And you're right. And also we have to be flexible, you know. So I think at the beginning of the pandemic, we thought, oh, 14 days. And then, oh, 30 days. Oh, 60 days. And for the first year, we were literally waiting for the day that COVID wasn't around, right? And as 2 years in almost, who knows if COVID is ever going to leave our community. So how do we navigate? How do we adapt? Right now we have variants that are coming left and right. So being able to be adaptable and flexible is something that we really learn, and we plan knowing that it might not happen. But instead of being paralyzed, we're going at it. And then, you know, just be aware that it might change. But right now we also start really slow, because it would not be responsible to come back with the biggest pool party in town. Like, you know what I mean? We have to start getting ourselves back into our communities in a safe way, and allow people to feel comfortable little by little as we progress and as more medications or vaccines come to the market. So we starting slowly, but we are planning. We're not just frozen anymore. We're moving forward. And if we need to adapt, that's one thing we've learned, right? Yeah. We know how to adapt now. We know how to move forward, how to go back in lockdown, how to get out again, mask, no mask. It's been a juggle for the last year.
Absolutely. Yeah. And I think another lesson for me through the pandemic is a reminder of our interdependence, right? Like how much we really need each other, both not only to survive, not only to thrive, but also as we are flexible, as we are trying to meet people where they're at, as we're trying to, you know, to your point, be flexible in how we are in community and building community with one another, which I think is an important reminder that even when we were quarantining or like that we still needed each other, we were trying to find other ways to stay connected and support and love on one another as well.
And you know, one thing that I've realized personally, and also just seeing my teams, is I do think that the platforms like Zoom and this did wonders for us. But there's the more and more I think is you cannot replace the physical connection, the just having people around. I mean, the connection goes to a different level. So I do believe, you know, we're human beings. We want to be around other people, and there's a beauty. I appreciate, like I just had my meeting today for the first time in a long time with 25 people of Impulse, and it was so magical just to see people's faces. You know, sometimes we have a filter through social media where, you know, we see everything filtered. You know, even right now I have a light to filter me, right? But when you see them in person, it's just that raw love and connection that I don't think can be replaced. And I feel like now more than ever, personally, I value it when before I will sometimes take it for granted.
Yeah, that's such an important point, because especially if I identify as an extrovert, so I was itching to be around
Same.
And so for those first couple of months where I was like, all right, so this is going to be some time where we're going to be, you know, feeling these levels of isolation. So finding that balance, and to your point, not taking it for granted when, you know, because of science, because of medicine, because of the vaccine, we are able to, you know, now be able to meet in person. And so how do we take advantage of those moments and then also not take them for granted?
Right. Agree. Totally agree.
You know, so you started off the conscious conversation with talking about saying, you know, today is World AIDS Day. So I want to take a moment to talk a little bit about that. So for those who may be not familiar, could you tell us more about World AIDS Day and maybe talk a little bit about how this celebration, or how like honoring or recognizing this day has shaped your dedication to activism and the LGBT community?
So, you know, I mean, World AIDS Day, it's about remembering and paying respect to the thousands of gay men or trans or queer individuals we've lost in the fight against HIV and AIDS. And, there was once upon a time where HIV was a death sentence, AIDS and HIV was so, it was our biggest fear as gay, as queer individuals. And I even think it defined a lot of who we were. So I think when the day came is international, is we have to remember where we come from and we have to respect those we lost in the fight. So that's the whole point of World AIDS Day. And for me, the way that it has shaped me is, believe it or not, there's still people dying every single day in the United States and around the world who, I live in the city of LA and you in DC, we have a lot of accessibility to treatment and to PrEP, and in our minds, everybody's on PrEP, or in our minds, nobody's dying of HIV and AIDS, but the reality is that they are. So the fight is not over. So for me, World AIDS Day is just a reminder that we're still losing people every day to this disease, and that is still 85% of it is a queer gay disease. So the fight is not over. And the more we keep fighting, hopefully, the less people we lose. And it's just a reminder that the battle and the work is not over.
Definitely. I know. So my understanding is that this year's theme is ending the HIV epidemic, equitable access, everyone's voice. Can you speak to about what that means to you and how we can work for, that equitable access and ensuring everyone's voice is heard?
The being equitable and access is going to be a struggle for years to come, right? We are trying to dismantle something that's been created for centuries, if not decades, long time, right? And if you look at this, like who is really becoming HIV infected? So the CDC released their findings yesterday or in this week, in which it showed that as a whole in the United States, HIV has dropped, but it has only dropped for white Caucasian males or whites. And then you look at people of color, Latinos and Black, and our infection rates are going up. So you look at this and it doesn't take a rocket science to understand why overall infections are dropping, but only in one demographic, only in one race. And then you look at the other ones, Latinos and Black, and everything's going up. So there's a huge gap of resources. And, and also culturally, I always tell people, I was born and raised by a Mexican mom, right? And in my culture, we don't go to the hospital or demand or access, things that even if they're there for public health, we just not brought up that way. So we don't fight for what is ours also, right? We kind of just, the same people keep getting the same benefits. So I do think, for Impulse, we were talking a lot of how do we talk to the Latinx community, the Black community? How do we bring resources to those areas and educate them to know that there are free services out there, that your healthcare or being on PrEP should not be based on your race. It should be based on the need. And PrEP is also, once again, mostly for white gay males, or at least the ones who are using it. And there's nothing wrong with, I'm not talking bad about Caucasians or white people, right? There's nothing wrong. It's just we don't have the same access or we don't have the same information. So with Impulse, we're really working on how do we target those demographics. And even for AHF, I work for AHF, which is a nonprofit. My whole job is to ensure people get their treatment, whether they have money or not. And I'm doing my job with AHF to ensure that everybody can have access to PrEP, that everybody can have access to a doctor and to treatment, regardless of ability to pay. It shouldn't be about money and about race. It really should be about need. But we have a long way to go.
Yeah. For folks who are tuning in and they're like listening to you speak, Jose, and they're like, okay, well, what could I do right now? What is a way that I could help, broaden access, create to make sure things are more equitable and that more folks, and particularly people of color, are able to access the medicines and care that they need? What would you tell them that they could do?
I will start by look at what resources your city has, right? Sometimes it doesn't, you can Google the world now. But really understand what resources you have. I'm always surprised how people, even in the city of LA, they're like, oh, we didn't know we had a queer recovery center. Oh, we didn't know we had a free PrEP clinic. So I do think that let's, as individuals, just inform yourself a little bit. Look at what resources you have. And then even though sometimes we want wait for people to come to us. We also have a responsibility to seek out and see what's out there. So I will say that first. Look at what we have. Look at what services are out there, nonprofits, and we all have a lot in our city, especially in big cities. And then reach out. And if you don't know how to navigate, let's say you were dealing with drug use, or addiction, or you need PrEP. If you don't find it out there, email. There's an Impulse in every single city in the major city in the United States. We can connect you. We call ourselves linkage to resources. So definitely Impulse can help. Check out your public health facilities or locations, or there's a way to get informed of what's out there. And then it's up to us to really seek out. And if we don't see it, ask questions. But we need to demand the services too. Sometimes I can be a little passive too. I'm like, no, I want this. We need to go get it.
Absolutely. Absolutely. I think this was kind of alluded to when you were kind of talking, but I want to talk a little bit about the stigma that comes with HIV and AIDS and what it means to even have more shows like Pose and other things in the media that help to our earlier point around sharing stories, talking about the impact. Can you tell us a little bit about how Impulse and how AHF are working to tackle or to tackle the global stigma, and if they're and the impact that this kind of representation and the kind of storytelling that the more of it that we're seeing is having on the community?
Well, I do think we need more representation. You talked about Pose. I mean, there are we're starting to see some stories that are more accurate of our stories. So I do think we need more of that. I sometimes we think we're on it on our own, and especially in the Black and Latino X community, or we just don't talk. When we were doing this documentary that I talked to you about, we really had a difficult time getting people of color to participate. We had, and then I was like, why are we having such a hard time getting, a Black or Asian or Latino to talk about their stories? But it's because we don't do that. So when we don't do that, there's stigma around our stories. If you're Latino positive gay man, there's a stigma like, of course you were. What were you? Like, if you're Mexican, Latino, or if you're Black, statistically they're saying that half of Black men will be positive enough. And it's just some statistics are out there that when we deny our stories because we don't want people to think of us differently. Our families, there's stigma in our families, the religion, culture, families, being from the South. So all of that, we already come with stigma surrounding being a gay man. Then you add HIV, and then there's this stigma is like, well, I did it to myself. Well, this is part of being gay. You're gay, you're HIV positive. They go together. I think, for Impulse, it's providing a space, a brave space for people to talk about their stories, and to allow them to be celebrated and not be stigmatized by either HIV or, drug abuse or whatever the case may be. But we need to provide the space, because once we provide the space, what I've seen is the healing begins. A lot of gay men, we just need a space. We need other people to talk to. So we are definitely working around that to make sure that we reduce the stigma by allowing people to share their stories and showing other people that they're not alone. As AHF, AHF being the biggest AIDS foundation in the world, I mean, it's about treatment and getting people treated everywhere around the world, regardless of resources, because also part of the stigma comes is, well, if you're HIV, you died of AIDS, and that's not true. So once people realize that it's a chronic disease that is not going to kill you, and that you can be HIV positive and have sex with somebody and not transmit HIV if you're undetectable, like all of that, that takes some of the stigma away. U equals you. So for anybody who may not know that, being undetectable means untransmittable, which means if you're taking medication and your T cells are under 20, the likelihood of you passing HIV is 0, right? That is huge data. That's a huge thing to share, but people still don't believe it's true because of all the stigma that's around HIV. And I'm like, well, it's not. It's true, it's factual. So I do think with treatment and providing people care will eliminate little by little some of the stigma that comes with HIV and AIDS and the misinformation that still exists.
Absolutely. You mentioned, I appreciate you kind of talking about what it means to be undetectable. You also mentioned kind of the T cells being under 20. For folks who maybe aren't as familiar, can you share a little bit more about what that means or how that is connected to what you were talking about?
Yeah, so I mean, being undetectable, it's a term that we use in the world of HIV and AIDS. And what to be undetectable means that your copies of the virus is less than 20. And which also, like right when you, just for people, when you're newly diagnosed, you can be in the thousands of copies, right? It's rampant, which makes you really infectious. So the people who are newly diagnosed are usually the most infectious, just because it's just the way the virus is reproducing. Once you get into antiviral medication, ARVs, it can if you take it by a couple months, most people 3 to 4 months, they reach a level of undetectability, which means there's almost 5 copies in your system, in your blood, which makes you undetectable. Which, if you have sex with somebody, with or without a condom, whatever role you play, there has been research that shows zero conversion, which is great. Which means if we get people who are HIV positive in treatment, we literally can eliminate the epidemic right now. We have the tools to do it.
Thank you for that. As you're kind of describing that, it kind of makes me think about, like, what is a hope? Like knowing the technologies, the advancements, the medication that we have available, things that are being, continued to be worked on. What is a hope that you have for the future as it relates to the work that you do?
I hope that I have no job in 5 years. And by that means I really do see that we will find a cure. I now that I work in pharmacy, and I work for a nonprofit, so I still have some kind of a soul. But what I've learned in the last 5 years of working in pharmacy, especially infectious disease medication and treatment, is how corrupted pharmaceutical companies are, and how medication is similar to an iPhone. They don't give you the best iPhone right away, right? Every year the iPhone improves. I mean, I wonder, they didn't have that technology last year, but they probably did. The same thing with HIV medication, right? They're giving us an improvement every so often. Why? Because the moment they do that, they can patent their discovery for another 7 years. So there's going to be a time where they're not going to be able to continue to upgrade the medication and patent it, so that they're going to milk HIV until they can. But I do believe that there's a cure that's going to happen in the next maybe 5 to 10 years, but then it's going to take a long time to give it to the people who really need it. And then we were talking about being different communities or disparities. It's going to happen too. Once we get the cure, it is going to be another 5, 10 years of getting it to the people who really need it. So we still have a while, but my hopes is that one day gay men can live as gay men without having gay and HIV in the same sentence.
Thank you. I am going to help speak that into existence and do what I can to help build that future for you, for me, for all of us.
And and sometimes, sometimes I don't even know if I'm going to be here, and I always tell my team, I'm doing this work knowing that I might never even actually see the impact. And I think that's the beauty, and that's a real advocacy, where people do work not for the recognition or not to see the results, just for the greater good, even if he or they may not see the end results.
Absolutely. I think that's the beauty and the challenge, right? Like, we do this work because we are grounded in community, because we know the impact that it could and could have, especially in the future and later down the line. And does that necessarily mean we may be here for it? Maybe, maybe not. But that's why it's important for me to really ground ourselves in what that broader vision is, and how do we excite more people. And I see you, through the work that you do with Impulse, doing that in these chapters across the country, and especially the way I get to experience Impulse DC. It's so beautiful, because I'm like, wow, I do feel safe. I do feel like I can be brave and be my full self and not worry about what other folks think, because that's that is the kind of spaces that have been cultivated. I know you said you're with chapter leaders now today, and I imagine you've been in communication with folks from all the chapters. Curious, what's something, especially looking back at the 12, 13 years that you've been doing to build this organization, this network, and this community? What are you the most proud of?
Ooh, I mean, I definitely, I mean, just also with the growth, I never in my wildest dreams could have imagined that we will be in all the 5 continents, and a couple of the highlights of those were when we went to Africa and we opened in Cape Town, it was just like, how do I end up here? India, when I went to the slums in New Delhi and I worked with the trans community there and I saw the crime and I saw, 5 years ago, it was criminalized. So we were meeting kind of like underground. And now I've been able to see these cities and it's been really eye-opening. It's probably some of my greatest joys because I've been able to see the world not as a tourist or a foreigner that goes and visits to the nice hotels and the beaches and the restaurants, but I've been able to see the world through the lens of people like me everywhere. So for me, that has been a great joy and satisfaction. And I think my biggest takeaway and what I'm really grateful is I've been able to mentor younger gay men the way that I wish I had been mentored when I was younger. And that for me has been the biggest joy is I have friends, real connections with gay men globally that I never thought I would. And they're meaningful. And that has been my proudest moment.
That is awesome. Speaking of younger gay men, some people say,
and they keep getting younger by the day,
which is awesome. To that point, I wish I had the courage to come out as early as some of these young folks are coming out. And so I'm hoping that continues and that more and more people feel that comfortable starting as young.
It's beautiful, isn't it?
It inspires me. I said I was not that brave when I was younger, and but to see you all, like here's to the future, more and more people feeling like they can do it at such a young age. This next question, some people say is my RuPaul question. But
so don't mess it up. I get it.
But in thinking of younger gay men, if you could offer a piece of wisdom to your younger self, and to LGBT youth, what would that wisdom, what would that piece of advice be, and why?
So I would tell myself 2 things. And when I think of my younger self, so I was very outspoken when I was 14, 16, 15. I used to wear platforms and bell bottoms, and I used to own it. And I would, like you said earlier, I was pretty brave, even though I was, in a small town in California back then. So props to my younger self. And I say to all those queer, people out there, own it. And that is beautiful. Just having the strength to walk in with makeup or, to wear heels or, to be more of a tomboy, whatever it looks for you, own it and appreciate it. And I can guarantee you one day you're going to look back and say, you know what? You were just awesome. One thing I wish I could have done more, I don't think I was a mentor as much as I wish I was. I think as a community, we can be a bit disjointed. And, I really didn't do a good job venturing out to different races. I say really Mexican Latinx. So I think, I will tell my younger self, you should explore more, get out of your comfort zone, meet other people that are different than you, and really celebrate other people's differences. I think I learned that too late in life. I did, but I wish I did that early on.
Beautiful. Thank you for that. And I feel like you've been able to touch so many people through your work with Impulse, both directly with chapter folks that are actually building these chapters all across the country, but people like me who I know that we've had a chance to meet before in different places, but the work that you have done has has a rippling effect. So I want you to know, as
Thank
someone
you.
who doesn't have the chance to engage with you as much as some of the other folks that I know, that I am grateful for what you have done, are doing, and will continue to do.
Well, thank you.
Um, um, so I guess the one question I have is around, I know I talked a little bit more about, you gave some ideas about what people could do, but if people are listening or tuning in and are like, okay, I want to support Jose, I want to support Impulse Group, I want to support AHF, are there any campaigns or projects that you all are working on that folks could support or participate in, or how could folks support you in the organizations you're a part of?
So definitely, if you people visit our website, right, impulsegrp.org, we have 12 chapters in the United States, in most major cities. I will say if you want to support, check it out. In the website, you can look at the specific chapter or follow the specific chapter or city that you're in Instagram or Facebook. We are getting back and activating and doing events and doing campaigns, but that will be a great way to get involved. Or check us out, right? And if you might like it, you might say, you know what, I like what these guys are doing. Let me try to volunteer. So definitely connect with the local chapter, attend one of their events. One of the main focus that we're going to be looking at right now is there's a lot of mental health conversations, right? Like after the COVID, a lot of our groups, we want to really work on that. Like what can we do as a social group to help, gay men or our peer community kind of heal and deal with the long-term trauma that COVID caused. So if mental health interests you, definitely get involved with us, reach out to us, see when is our next event. That is going to be one of the main pieces, and also the way that we've medicated ourselves and deal with the trauma. So talking a lot about mental health and also substance abuse. Alcoholism is on the rise. Meth use, left and right. So we are dealing with the trauma and our issues of mental health through really unhealthy ways. So if those topics, I'm hoping is of interest to most people, because how can you not, right? Where we at? Reach out, check out your local chapter and get involved and at least attend. Maybe you'll find it's the right fit for you, or if you are struggling with issues around mental health and substance abuse, maybe you will learn something.
Awesome. And we come to the point in the conversation where I invite you as the guest, Jose. Are there any questions that you want to ask of me?
So what does World AIDS Day mean to you?
Yeah, so for me, World AIDS Day also is a reminder of how far we've come, how far we have to go, and what my role and what my reaffirmation of my commitment to that goal is. And I think it's also it's a timely point of the year too, being the end of the year. Folks are kind of thinking about what the new year is going to what their commitments are going to be for the new year. And so I think that is part of how I think about it and how I try to reflect. I'm also mindful, especially as someone who is gay and who's had the pleasure and the honor of being able to work with generations of gay folks, that I hear, especially from elders, talk about how much how much things have changed, and how you kind of talked about this earlier, that people used to live in fear, and there was a different and it impacted folks in very big and big ways. And so I also try to ground myself in that. How do I keep myself focused on what we could do more of, while also continuing to remind myself how much we really have come, and
Right.
and how grateful I should be for the folks who came before us, and that their work should not have been in vain, and that their deaths should not be in vain. I need to continue to commit to build that freer, that safer, that more welcoming world for more people.
Yeah, oh, I love that. So what did conscious conversations came about?
Yeah, no, I appreciate this question. So the first conversation actually happened at the beginning of the pandemic. And I was talking to a comrade of mine, her name is CC Battle, and we wanted to be able to start talking about the impacts of the pandemic, not just the health impacts, but the social impacts, the political impacts, the environmental impacts, and to help people understand like what are the different ways in which we need to be mindful. Like clearly, it was like in February, March of the pandemic, so it was still early on. There were still lots of questions that needed to be answered, but people were starting to feel the effects of it, you know. And so, and ever since then, it kind of evolved to be an opportunity to lift up BIPOC leaders, organizers, folks who lived at different intersections. So LGBTQ folks, people with disabilities, women, immigrants, et cetera. And as a platform to not only lift up these people, but also their stories, the things that they were doing for community, and a way to try to strengthen and connect networks across the country and the globe. So that is how it started, and how we hope that we can continue to use this platform in that way.
You know, I love you sharing that story. And I always say, you know, great things, you know, like this, or even Impulse or other, comes sometimes out of fear or out of experiences that maybe not the best experiences, but that's how change and movement happen. And my last question, I promise, because, you know, I can ask you questions for days. What has been your biggest joy so far?
My biggest joy. My biggest joy has been, well, I'll say this. One thing that I also I took from the pandemic, because I shared at the beginning, I'm a dancer, but it took so long for me to own that part of me, because I think growing up, I was told that being a dancer wasn't going to pay well, that being a dancer was not like not professional enough. Being a dancer was, you know, a fun thing, but like not something that I should really invest in. And so I think I held that in a lot. And so as I really opened myself up to saying, no, being a dancer is not only a big part of who I am, but it helps me with my healing. It helps me navigate, express myself in ways that I can't do in writing or verbally or in other ways. And so I've really owned that part of who I am, and have not cared about like how people think, like, you know, I do a lot of facilitation, and so I bring dance and body work and movement into my facilitation. And sometimes people are like, "You're gonna make us do a dance right now for a couple of minutes?" I'm like, "Yes,
Yeah.
move your body. This is exactly what I'm doing." That's brought me joy, and I think it's been a superpower, if you will, and me helping connect with people, and to help people move their bodies or feel the beat and feel dance and love in their bodies and in community.
Awesome. Thanks for sharing
Well,
that.
of course, I appreciate those questions. Seems like you do this, or you've done this before, Jose. Grateful that you took some time today. Thank you so much for joining us for this conscious conversation. I'm looking forward
Thank you.
to other ways that we can continue to build and continue to support the work that you and Impulse and AHF are doing. Thank you again, and happy World AIDS Day.
Happy World AIDS Day. Take care, all right?
Take care.
Take care. Bye.